If you have a dental sleep medicine office that offers multiple treatment options, maybe you have mandibular advancement, you have expansions through a clear aligner program, or maybe you have a more permanent solution like Vivos. If you have multiple options, one of the tendencies that those types of offices have is to just word dump on patients in a case presentation and say, here's all your options, here's everything we offer, we do laser, we do this, we do this, we do that. The trouble with that is you overwhelm the patient. The best thing you can do is start asking the patients questions that get them to tell you what would be the best option for them. So for instance, you might have patients that want to and are only able to rely solely on insurance utilization. So a mandibular advancement is really possibly the best solution for them. Maybe they're not looking for an orthodontic solution. They're okay with wearing a mandibular advancement device and they just want to stick it in at night. They want something that's portable. They don't want to have an 18 to 24 month treatment drawn out. Maybe they're scared of a laser, even though it is very, very safe. Maybe they don't want to go that route and do a soft tissue procedure. So really, instead of word dumping on your patients in a case presentation, ask them questions so that they can tell you what they feel like is the best solution for them.